Since the discovery of penicillin in 1928, antimicrobials have revolutionized modern medicine. These powerful drugs, including antibiotics, antivirals, antifungals, and antiparasitics, have become our primary defense against infectious diseases. They work by killing or inhibiting the growth of microorganisms, protecting us from infections that were once deadly. Antimicrobials have saved countless lives and transformed healthcare as we know it. However, a silent pandemic now threatens this medical triumph. Antimicrobial resistance, or AMR, occurs when microorganisms evolve to withstand the drugs designed to kill them. This means that infections that were once easily treatable are becoming harder and sometimes impossible to cure. As resistance grows, we risk returning to a pre-antibiotic era, where simple infections could once again become deadly. The implications of AMR are far-reaching, impacting human health, animal health, and the environment. It is a complex problem that demands immediate attention and a coordinated global response. Antimicrobial resistance is not a new phenomenon. It is a natural process that occurs when microorganisms are exposed to antimicrobials. Some microbes possess genetic traits that allow them to survive in the presence of these drugs. These resistant microbes can then multiply and spread, passing on their resistance genes to others. Human activities, however, have significantly accelerated the development and spread of AMR. The overuse and misuse of antimicrobials in human and animal health are major drivers of resistance. This includes prescribing antibiotics for viral infections, using them as growth promoters in livestock, and not completing the full course of prescribed antibiotics. Poor infection control practices in healthcare settings and inadequate sanitation and hygiene also contribute to the spread of resistant microbes. These factors create ideal conditions for resistant organisms to thrive and spread, exacerbating the AMR crisis. The consequences of inaction in the face of rising AMR are dire. As resistance grows, our ability to treat common infections diminishes. This leads to longer hospital stays, increased healthcare costs, and higher mortality rates. The World Health Organization estimates that by 2050, AMR could cause 10 million deaths annually, surpassing cancer as a leading cause of death worldwide. The impact of AMR extends beyond healthcare. It poses a significant threat to food security. The use of antimicrobials in agriculture is widespread, and resistant bacteria can spread from animals to humans through direct contact, contaminated food, or the environment. This can lead to untreatable infections in humans, threatening our food supply. Moreover, AMR has profound economic implications. The OECD projects that by 2050, AMR could cost the global economy up to $64 trillion. This includes healthcare costs, lost productivity, and the impact on trade and tourism. The severity of the AMR crisis is reflected in the alarming statistics on drug resistance. The WHO has identified antimicrobial resistance as one of the top 10 global health threats facing humanity. It is a complex problem that requires a multi-sectoral, coordinated approach to address effectively. Data from the Global Antimicrobial Resistance and Use Surveillance System, or GLASS, paint a grim picture. The 2022 GLASS report revealed that resistance to third-generation cephalosporins, a critical class of antibiotics used to treat severe infections, is widespread. More than 42% of Escherichia coli isolates, a common cause of urinary tract infections, were resistant to these life-saving drugs. The rise of methicillin-resistant Staphylococcus aureus, a bacterium responsible for difficult-to-treat skin and bloodstream infections, is another major concern. GLASS data show that 35% of Staphylococcus aureus isolates are now resistant to methicillin. This highlights the urgent need for new antibiotics and alternative treatment strategies to combat these resistant infections. Section 5. Bacterial resistance, a persistent menace. The emergence and spread of resistance are not limited to bacteria. Fungi, viruses, and parasites are also developing resistance to the drugs used to treat them, posing significant challenges to global health efforts. The World Health Organization is particularly concerned about the rise of drug-resistant fungal infections, especially Candida auris. This emerging fungus can cause severe infections with high mortality rates, particularly in healthcare settings. Candida auris is often resistant to multiple antifungal drugs, making it challenging to treat. The DO has included Candida auris in its fungal priority pathogens list, highlighting the need for increased surveillance, infection control measures, and the development of new antifungal treatments. Section 6. Beyond bacteria resistance in other pathogens. The development of resistance in pathogens such as HIV, tuberculosis, and malaria poses a significant threat to global health control efforts. These diseases disproportionately affect low and middle-income countries, where access to healthcare and treatment options is often limited. HIV drug resistance occurs when the HIV virus mutates, reducing the effectiveness of antiretroviral therapy. Antiretroviral therapy is a life-saving treatment that suppresses HIV replication, allowing people with HIV to live longer, healthier lives and preventing transmission of the virus. However, HIV drug resistance threatens the success of these efforts. The World Health Organization recommends routine HIV drug resistance surveys to monitor resistance patterns and guide treatment strategies. Early detection of resistance is crucial to ensure that people living with HIV receive effective treatment and to prevent the further spread of resistant strains. Section 7. A world without effective medicines. Imagine a world where simple cuts could lead to life-threatening infections. A world where routine surgeries become risky and organ transplants are nearly impossible. This is the stark reality we face if we fail to address the growing threat of antimicrobial resistance. The lack of effective antimicrobials would severely impact modern medicine. Surgical procedures, cancer treatments, and organ transplants all rely heavily on these drugs to prevent and treat infections. Without effective antibiotics, these life-saving interventions would become significantly more dangerous. Furthermore, the economic and social consequences of unchecked antimicrobial resistance would be devastating. Increased healthcare costs, reduced productivity, and disruptions to travel and trade would cripple economies and exacerbate global health inequities. Section 8. Combating antimicrobial resistance, a multifaceted approach. The fight against antimicrobial resistance requires a comprehensive, multi-sectoral approach involving governments, healthcare professionals, the agricultural industry, and the public. Recognizing the urgency of this global threat, the United Nations General Assembly held a high-level meeting on antimicrobial resistance in September 2024. The meeting, a testament to the growing global concern over antimicrobial resistance, focused on the urgent need for action to combat this silent pandemic. A key outcome of the meeting was a political declaration negotiated by Malta and Barbados, outlining commitments to strengthen national action plans, improve surveillance of antimicrobial resistance, and promote research and development of new antimicrobials. Section 9. The urgency of now, a call to action. The time to act is now. Antimicrobial resistance is a complex challenge, but it is not insurmountable. By working together, we can preserve the efficacy of these life-saving drugs for current and future generations. We must raise awareness about antimicrobial resistance, educate the public and healthcare professionals about responsible antimicrobial use, and strengthen infection prevention and control measures in all settings. Investing in research and development of new antimicrobials, diagnostics, and alternative treatment strategies is also crucial. Ultimately, tackling antimicrobial resistance requires a global, coordinated effort. Sharing knowledge, best practices, and surveillance data across borders is essential for effective prevention and control. We must act now to preserve the miracle of antimicrobials and safeguard global health.